Well, welcome to Burlington Denture Clinic. We are here with Peter, who is the owner slash denture specialist.
Good morning.
At a beautiful spot here,
Yes,
gorgeous
thank you.
offices.
Thank
Thanks
you.
for having us.
Yeah, you're welcome. I'm glad to have you guys here. Yeah.
It's an interesting thing to talk about because not everybody needs to talk about it, but when you do, it is such an important thing.
Absolutely.
Dentures.
Absolutely.
Your smile is the first impression
Yes.
for most people, and you want it to be your very best.
That's right. Yeah.
So
It's the first thing you see when you look at somebody, right? You need it to function. It's an important part of everyday life.
Yeah.
Absolutely.
hey, I can't help it, and I'm going to brag a little bit for you here, but you've got quite a few awards up there.
Yes. We've been fortunate since we opened here in 2010. We've won the Burlington Post Reader's Choice Award.
Wow.
For the last 13 years. Yes.
Congratulations.
Yes. Thank you.
That's a big honor.
Thank you.
Okay, tell us a little bit about your clinic. What do you guys do here? Show us around. Give us a tour.
Absolutely. We've been here since 2010.
Okay.
We fabricate dentures. This is our one operatory here. So this is the operatory that we work out of, one of our examination rooms here.
How many compliments you get on the world map that people get to study?
People love that. Yeah, we get
bet.
offers all the time. Yes, absolutely.
That's awesome.
Yeah. It's something to look at. Pick your next vacation while you're waiting, right? Yeah, absolutely.
Now, someone that
Another
needs
operatory.
dentures, like how do you make the experience less intimidating for them?
I mean, as soon as you come in, you see Shannon, right?
Yeah.
So she's our friendly smile. She greets you. She's very warm. We have a nice sterile facility here. Patients are able to come. We're actually able to facilitate dentures from start to finish right here in the office.
Really?
So
you
we
don't
don't
have to send
require
them
a
away?
referral. No, they can do it right here.
Okay, that's amazing.
Yeah, start to finish. This is our associate Julia.
Hi,
Also
Julia.
my sister, and she also makes house calls. She sees patients as well for us. So
Wait a second, hold on, back up. House calls?
we make house calls, yes.
How
We're
does
one of
that
the
work?
rare ones that do. So we're actually able to go into your home or a nursing home or a hospital and facilitate denture fabrication from start to finish.
Really?
Yes.
Wow, that makes people's lives so much easier
lot more
because as people get
convenient.
older,
Yes.
sometimes it's hard for them to get from A to B and where they
100%.
need to go. So the
Yes.
fact that you guys will actually go to their house is such a fantastic service.
Yes, yeah, it is.
Wow.
It is, yeah.
Okay, so from start to finish, we are going to be showing a little bit of your 3D printer a little bit later
absolutely.
on. So
New technology.
don't go anywhere. There's a lot more coming up from Burlington Denture Clinic on Morning Live. Back at Burlington Denture Clinic, and we are learning about the different types of dentures. Now, Peter, I know dentures have come a long way. When my grandparents had dentures, they would literally take their mouth out,
Yes.
it looked like, and put it in the glass beside their bed. That's no
Absolutely.
longer the thing, really.
It is. We still offer full dentures to patients who are missing all their teeth, but
Okay.
the options have improved since then.
Okay.
Okay, now we're actually able to offer patients dentures on implants, so it's a snap-on denture.
That's cool.
So how that works is 2 implants are placed, and the denture is actually fabricated to snap on and off of those dentures, right? So once that snaps in, we have very, very predictable stability.
That's
So
cool.
that denture is not going to move. We don't need to use any
Because
adhesive or
they used to
polygrip.
use like a grip,
Yes,
like a slimy
exactly.
kind of
No.
toothpastey looking thing.
With this, it's not needed.
That's amazing.
It's amazing. One step above that, we're actually able to make fixed dentures or fixed bridges now.
Okay.
Where actually 4 implants are placed.
Yep.
And then we're actually able to screw retain that bridge right into those implants.
Wow.
So we have access holes through the teeth, and we
Yep.
actually screw it. So this is non-removable.
It's not coming out.
Patients aren't able to take it out. We take it out once a year for proper hygiene. Okay, but this is right into the
Just
gums.
once a year?
Nothing gets underneath it. Yes.
Wow.
Yeah. Nothing on the roof of the mouth. You're tasting your food again. No denture flange. It feels as close as you can get to your own teeth.
That's cool.
Yeah, it's
Okay.
amazing. And then even a simple denture. We used to do cast dentures where we had the metal clips on the front, and we still do a lot of these.
Oh, yeah,
However,
okay.
there are better options for patients who don't want to show that little silver around their tooth. We actually
Yeah.
are able to make it in a flexible material.
Oh, cool.
So this is metal free for patients who have allergies to metals, or even if they just want a better aesthetic result. We're actually able to have a denture fabricated out of a vinyl material, and then that would go over the tooth instead of that metal frame. So it's more cosmetically pleasing.
And this is only if you're missing a couple of teeth, right?
Yes, if, anywhere from 1 to even 12 teeth, we can facilitate a flexible partial. Yeah.
Wow, that's so cool. I
Yeah.
had no idea that the technology had come this far.
Yeah, it's amazing. It's amazing.
And how long have you been a denturist?
For 17 years now.
17
Yes,
years.
yes.
Wow, so you've obviously experienced a big change in
It has.
dentures.
The industry is changing. It's actually even getting into 3D dentures, milled dentures, digital dentures. We're actually able to mill it from a puck. So this is one monolithic puck. So it's a stronger denture. It's a more accurate denture. The fit is more accurate. It's more
These are the ones that you
predictable
pull
as
out.
well. Yeah, exactly. But they've come a long way from the conventional.
Yeah.
In the sense that the fit is more predictable, and even the way they function
It looks
is
more
a lot.
comfortable.
It is, absolutely.
Like it looks more comfortable in your mouth.
Yes, it is. Yeah, it's more accurate. So the fit is going to offer more stability, even without the use of implants.
Wow.
Yeah, it's amazing.
Okay, and I mean, you see all kinds of people. You see anyone from, hockey players to football players to elderly to people, anybody can come in for a denture fitting.
Anybody, yeah. You can come in off the street. We got a lot of dentists that refer to us as well.
Yeah.
We help out a lot of practices in the city, oral surgeons. We work with a lot of dentists and collaborate. We don't place the implants here. We have surgeons and dentists who place them, and then we would actually make the prosthesis right on top of that.
Oh, that's cool.
Yeah, so we work in collaboration.
Here, you can have your teeth back.
Yeah, thank you very much.
Well, coming up, we are going to be taking a look at that 3D printer. There's a lot more coming up from Burlington Denture Clinic. For now, sending things back inside the studio. I'm now in the patient chair at Burlington Denture Clinic. Peter is going to demonstrate how I could get fitted for dentures. Now, if I'm a candidate though, correct? So there's a couple of ways that you can fit people for dentures.
Exactly. There's a traditional way that we would fabricate a denture using your standard stock trays with the metal frame there. And we still use that as well. But if patients are a candidate for a digital scan, we're actually able to do that. So it's less invasive in the mouth. It's actually more accurate for us to make the denture on as well.
Okay, and this is a fairly new technology
for denturists. It's been around for a few
denturists.
years, yes, yeah, but it works really well. I could show you guys how it works. So
Yep,
we can do a
let's
quick
do it.
scan in your mouth today.
I'm ready.
Yeah, let's try it and I'll show you.
Okay. So it's such an easy process. You just have to come in, make your appointment. Everybody here has been so great. They've been so friendly, so kind, welcoming.
Thank you.
I'm not nervous.
No, good. It's basically a camera. All it does, it takes thousands of little pictures.
Yep.
And it will show up on the camera here what we're scanning in your mouth.
Okay.
And then we're able to make the denture on that.
Okay.
All right?
I'm ready.
Let's try it out.
So you can explain to Luke what you're doing because I'm not going to be able to talk.
So I have this camera here. It's a little wand. And I'm just going to basically just wave it around Emily's mouth and it's going to show me where her teeth are, the position of the teeth, her gums with much accuracy. So what I'm doing in the mouth will actually show up on the computer screen.
All right.
All right? So let me show you how that works.
Okay, I'm ready.
All right.
Oh.
Close a little bit for me.
All right.
All right.
That is super cool.
That's
And
pretty
now
much it. Another 30 seconds and we'd be done.
everybody knows what my mouth looks like on Morning Live. This isn't the first time they've seen it, though. Let me tell you, Peter. As advantage reporters, we got to do a lot of stuff.
Here we
But
are.
oh my
Yeah.
gosh, that is
Isn't that
the
neat?
exact picture
Beautiful.
of my mouth.
Right?
Super cool. Okay, we're gonna print out my mouth next.
That's
Or
right.
maybe a version of it. Right? Lots more to come on Morning Live. Well, we are printing teeth. That is exactly what you were seeing here at Burlington Denture Clinic. We are with Peter, and Peter, explain the 3D printing process to us.
So after we've done the scan, we're actually able to design on the computer the denture. And then from there, we're able to create a mock-up. So that's actually a preview that's being printed right now.
That's so cool.
Okay, and then we're able to try that in to see how the teeth are going to look.
Yep.
Not so much the color, it's more of just a monolithic piece, but it gives us an idea of the bite and the look as well. And then from there, we're able to mill it.
This is kind of a weird question, but I'm going to ask it. Can people decide what they want their teeth to look like?
Absolutely.
Like, is there like a teeth magazine that
There
they flip
is.
through and they're like, I want my front teeth to look like that. I want kind of fangs on the side, or I want my butt, can they do that?
In a way, yes. We typically take control of that in the sense that the teeth are sort of mathematically sized to our face.
Right.
To the alleys of our nose, the outside of our nostrils should line up with our eye teeth. So
Okay.
that's one way we choose the size. And then also additional to that is our head shape.
Right.
More oval, more tapered, more square, decides the teeth shape.
So there's quite a little bit of like
A lot to
design in it as well.
Absolutely.
Now we're kind of like working here on your workbench. So this is where you would trim the dentures, where you would make sure all the final details are being taken care of.
That's right, some fine tuning. We also have the full service lab in the basement as well, where we have 2 full-time technicians there. This is sort of our halfway laboratory.
It's really cool that you do everything in-house.
In-house, start to finish.
I'm sure that makes the process a lot more smoother and a lot quicker.
Yes, and more accurate as well, right?
Yeah.
Because there's no middleman. So we take the impressions and we fabricate from there. So
it's a very personalized experience.
Personalized and precise.
Yeah, personalized and precise. I like that. Okay, so after it turns into this kind of white color, then where does this one come in?
Then we're able to mill. We have the milling machine downstairs. So we're actually able to mill the denture with the custom color, size. Of course, we have the pink to mimic the gums in the mouth, so then it's a lot more accurate. This is how it comes out of the milling machine, and then actually we're able to just pop that right out there. We trim up these little bore holes here, and then we're able to polish it up and get it ready for the patient.
That is so neat. And so these would essentially be their teeth when I touch them.
Yes, absolutely. Yeah, that's.
They feel like teeth. And they get polished, so they get shiny.
Exactly.
So they really look like teeth. That is so cool. Well, Peter, you've taught me a lot today. I did not know this much about dentures coming in here. So thanks for having us.
Oh, you're welcome.
Really
you're welcome.
appreciate
Happy to have
it.
you guys here.
All right, if people want to reach you, what's the best way?
You can reach us online at burlingtondentureclinic.com.
Okay.
Or give us a call at 905-333-8181.
All right, thanks, Peter.
Thank you. Thanks for having me.